students. So we are coming to the last part of mycology in this session. So we have completed superficial mycosis, subcutaneous mycosis and systemic mycosis. So in this session we are going to deal a very important topic, that is opportunistic mycosis. So what is meant by opportunistic mycosis? It is infection caused by a common saprophytic fungi which are usually non-pathogenic, but under special circumstances or when they get opportunity, like an immunocompromised host who is immunocompromised due to some infections or due to some immunosuppressive drugs they are taking, corticosteroids and all. In that condition, these saprophytic fungi can become pathogenic and they cause infection. So such fungi which causes infection, when they get an opportunity, you call that as opportunistic fungi, and the infection is called opportunistic mycosis. So the examples for opportunistic mycosis, the very classical example, candidiasis, then comes aspergillosis, mucormycosis, penicillosis and cryptococcosis. So the most important one which you have to learn in detail is candidiasis, but you should also know what are the fungus which causes the other conditions. So aspergillosis is caused by the fungus Aspergillus, and please learn some species of Aspergillus if suppose it is asked: Aspergillus flavus, Aspergillus niger and Aspergillus fumigatus. So these are the common Aspergillus species that causes aspergillosis, and the manifestations of aspergillosis can be pulmonary aspergillosis, or it can cause Aspergillus sinusitis, otomycosis, and even disseminated or systemic aspergillosis can also be caused by these Aspergillus fungi. And aspergillus, I hope you remember what is the appearance or what is the morphology of aspergillus. They produce septate hyphae. They are mold and they produce septate hyphae, right? And the spores are called the conidiospores. Now coming to mucormycosis, which is otherwise called as zygomycosis. Why? Because mucor comes under zygomycetes fungus. And there are two types of zygomycete fungus you have to remember, not only mucor but also rhizopus. And the infection caused by both of these is together called as mucormycosis or zygomycosis. And they can cause various kind of infection, and the most common kind of infection they produce is rhinocerebral mucormycosis. It will start from the nasal cavity, spreading to the sinuses, orbit, and it will progress to the central brain, central nervous system. So it is a very progressive angioinvasive disease which is having a very bad outcome. So rhinocerebral mucormycosis, it's a very fatal kind of condition that can happen in immunocompromised individuals, which is caused by rhizopus and mucor. And penicillosis, it is caused by the dimorphic fungi Penicillium marnefi. So it can cause cutaneous lesions and it can spread to different organs, to joints, bones. It can enter the bloodstream. It can cause lesions in different organs. So penicillosis is caused by a fungus called Penicillium marnefi, and this also happens usually in immunocompromised individuals. And the next one is cryptococcosis, which I have explained in the first session, which is caused by the fungus Cryptococcus neoformans. And this is a famous fungus which causes meningitis, usually in HIV individuals. So they cause meningitis in HIV. So it causes meningitis in HIV. That is what we discussed in the first class, Cryptococcus neoformans, which is the most common causative agent of meningitis in HIV. So the condition caused by Cryptococcus is meningitis, usually in HIV. So all these infections, candidiasis, aspergillosis, mucormycosis, penicillosis, cryptococcosis, all these are very common in immunocompromised people, especially HIV infected people. So we'll move on to candidiasis, which you have to learn in detail. It is asked number of times for the previous university exams. So it's a very important short note, as well as sometimes it can be asked as an essay question also. So candidiasis, it is an infection of the skin, mucosa and internal organs. Anywhere it can cause infection, starting from skin and mucosa and to different internal organs, and it can lead to a bloodstream infection also. It is caused by the yeast-like fungus Candida, and the most common Candida species is Candida albicans. So this is actually a normal inhabitant of the skin, GIT, oral and vaginal mucosa, And so the infection that it causes is an endogenous infection. You don't have to acquire candida from outside. It's already present as a normal commensal in our body. So the predisposing factors for candidiasis are the immunocompromised situation. The most common immunocompromised condition that you can see is diabetes. Diabetes will cause an immunosuppression, and immunodeficiency disorders like HIV, malignancies, especially hematological malignancies, prolonged administration of antibiotics can cause suppression of the normal bacterial flora, and that time candida can become pathogenic. Immunosuppressive drugs like steroids, which are the most commonly encountered immunosuppressive drugs, and patients who are on prolonged IV catheters, and also patients who are on urinary catheters for long time. So if those patients who are on intravenous catheters for long time, it can lead to bloodstream candidiasis. If they are on urinary catheters for longer duration, there is predisposition for urinary candidiasis. So we'll see what are the different clinical features of candidiasis, starting from the mucocutaneous lesions. It can cause lesions in the oral mucosa that is called as oral thrush. It's a whitish membranous lesion. It can lead to whitish discharge from the vagina causing vulvovaginitis. It can lead to conjunctivitis and keratitis in the eyes, onychomycosis, that is infection of the nails, and cutaneous candidiasis. Now coming to systemic candidiasis, it can cause urinary tract infection, especially in those people who are on urinary catheters, and also it can lead to intestinal candidiasis in some people, lead to pulmonary candidiasis, endocarditis, meningitis, and septicemia. So these are the systemic candidiasis. The clinical picture in systemic candidiasis, any of the organ can be affected. Coming to the oral manifestations in a little bit detail, you can see the oral thrush. The whitish membrane you can see here. So this is called as oral thrush. It is a whitish membrane over the oral mucosa. So it can be different manifestations, not only oral thrush, it can be chronic oral candidiasis, chronic mucocutaneous candidiasis, then angular stomatitis. You will see this whitish layer or whitish kind of lesions over the corner of the mouth, that is called the angular stomatitis, or circumoral candidal dermatitis. So these are the various oral manifestations of candidiasis. So we can see the different clinical types of oral candidiasis like pseudomembrane, which we call as oral thrush, erythematous lesions, hyperplastic lesions, and angular cheilitis. So pseudomembrane, they are actually whitish plaques which are loosely adherent to the oral mucosa. So when you try to remove these plaques, it may bleed at times. So you can call it as a pseudomembrane. And erythematous lesions can also be diffuse or discrete plaque-like lesions. Usually they are seen on the palate or tongue. Okay, and hyperplastic lesions, they are also diffuse white adherent lesions, usually seen on the buccal mucosa. Angular cheilitis, it is seen in the corners of the mouth with inflammation, erythema. It can be like fissures over the corners of the mouth, or ulcers. So you're going to diagnose, lab diagnosis of candidiasis. If you're seeing lesions which are clinically simulating candidiasis, you have to confirm it by microbiological investigations. So what you're going to do, you have to take a specimen. If it is mucosal lesion, you have to get the mucosal scrapings. If it is a conjunctival lesion, you have to get a conjunctival swab. Or if it is an onychomycosis, the nail sample. If it's a systemic candidiasis, UTI, you have to get the urine sample, pulmonary sputum sample, or in case of bloodstream infection, blood will be the sample. So you're going to examine it under the microscope for direct demonstration of the fungus. So you can do a KOH mount examination and also gram stain. Remember, gram staining can be done for Candida and Cryptococcus. So when you do KOH mount, you can see the budding yeast cells in KOH examination. And when you do gram staining, you're able to see the gram positive budding yeast cells in gram staining along with pseudohyphae. So you're seeing pseudohyphae also, that indicates that you're seeing a yeast-like fungus, especially Candida. So the most important species of Candida is Candida albicans. So when you culture it in Sebarodes dextrose agar and blood agar, see Candida can grow well in blood agar also. So when you do the cultures at 25 to 37 degrees Celsius, you will see the creamy moist colonies in Sebarodes dextrose agar. And when you have to confirm that this is Candida albicans, because you want to know whether it is an albicans candida or a non-albicans candida. All other species other than candida albicans, you call that as non-albicans candida. So this candida albicans, they will form germ tube when you incubate it with human serum. When you take this colony and you put it in a tube containing human serum and you incubate it at 37 degrees Celsius for 2 hours, after that, you're taking a drop of this sample and you're observing under microscope. You can see the Candida yeast cells, they have germinated to form long tubes. This is called as germ tube. So here you can see the germ tube. It will be like this. It will be germinating to form a germ tube. Okay, so that is a germ tube test. If this test is positive, you can confirm that this particular candida is Candida albicans, because only albicans will give a positive germ tube test. So again, this one is showing a gram staining that you have done from the colony, showing the budding E cells. Another thing that Candida produces chlamydospore. We have learned that among the asexual spores, thick-walled spores they produce in nutritionally deficient medium like a cornmeal agar. You take a nutritionally deficient medium which doesn't have much of nutrients, so then the fungus is in an unfavorable condition, so it will produce a special kind of spore called as chlamydospore. So this can be seen at the end of pseudohyphae. You can see the pseudohyphae here terminating in thick-walled spores called chlamydospores. So that is also characteristic of Candida albicans. So the two tests which you can perform for confirming Candida albicans is, one is the germ tube test and the second one is a chlamydospore test. Sometimes germ tube test can be asked as a 2-mark question. Coming to the treatment of candidiasis treatment, very important thing is you have to remove the predisposing factor, especially if it is a catheter-associated infection, a bloodstream or a urinary tract infection, you have to immediately remove the catheters because this organism will be colonizing in the catheter. So even if you give the drugs, it won't be effective, it will be persisting. So you have to remove the catheters or any other predisposing factor. If a patient is diabetic, you have to control the diabetic status. Then you have to give the drugs. So the drugs will depend upon, if it is a superficial infection, you can give topical drugs like nystatin or azoles. If it is a systemic infection, you have to give amphotericin B or 5-fluorocytosine has to be given in case of systemic candida infections. So this is a very important topic that we have discussed now, candidiasis. Pathogenesis and lab diagnosis of candidiasis is a previously asked question. In addition, I'll tell you germ tube test is a probable question which can be asked from candida, and morphology of candida can also be asked. You have to say the budding E cells, pseudohyphae and all, and sometimes chlamydospore formation should also be mentioned if it is asked. And the different diseases caused by candidiasis you have to be familiar with. And what is the most important species of Candida? That is Candida albicans. So once more, you can go through the previous questions which were asked from mycology, culture, stain and culture media, classification, dermatophytosis, dimorphic fungi, candidiasis, and though subcutaneous mycosis is not asked, it can also be a probable question which can be asked. So you have to learn the names of the 4 subcutaneous mycosis and the causative agents. So with that, we wind up the mycology topics, and thank you.